Hi friends, today I Namrata Pal, third year MBBS student of James Medical College Bojboj, going to discuss the facial nerve anatomy and its disorder with respect to ENT. Neuroanatomy is most difficult part as per my consideration, so I thought of making video on this topic. Now let us discuss. There are total 12 cranial nerves. The first is olfactory, which gets originated from the olfactory bulb. Next is optic nerve, it arises from thalamus. The third and fourth, that is oculomotor and trochlear nerve, originates from the midbrain. Next is fifth, that is trigeminal nerve, it originates from the pons. The sixth, that is abducens, seventh facial, and eighth vestibulocochlear, arises from the pontomedullary junction. Here we are most concerned about the facial nerve, which arises from the pontomedullary junction. Next is 9 and 10th cranial nerve, that is glossopharyngeal and vagus. Glossopharyngeal arises from the posterolateral sulcus of the medulla, and vagus also arises from the posterolateral sulcus of the medulla. Next is 9th cranial nerve, that is accessory spinal. It arises from the spinal cord and one component from the medulla. Next is 12th cranial nerve, that is hypoglossal. It arises from the anterolateral sulcus of the medulla. Here is the anatomy. As seen the brain from below, here it is pons. It is the midbrain, pyramid at the center and olive beside. Here is the middle cerebellar peduncle, both side. Now here we have tried to show you the origin of the cranial nerve. Here we can see part of the optic chiasma. In this image you can see olfactory nerve arising from the olfactory bulb. This is the third and fourth cranial nerve arising from the midbrain. Fifth cranial nerve, trigeminal, that arises from the pons. The sixth, seventh and eighth cranial nerve arises from the pontomedullary junction. Here is the pontomedullary junction. Here is sixth, seventh and eighth cranial nerve. Next is 9th and 10th cranial nerve, that is glossopharyngeal and vagus, arises from the medulla. Next is 11th, that is accessory spinal, one component from the brain and one component from the spinal cord. Next is 12th cranial nerve, that arises from the anterolateral sulcus of the medulla. Here it is. Now, here are the nucleus of the cranial nerve. This is we are discussing about the facial nerve. Facial nerve has 4 nucleus. One is sensory visceral efferent, one is general visceral efferent, sensory visceral afferent, general sensory afferent. Now if we see that facial nerve, that is 7th cranial nerve, here and here, the two nucleus, that is SVE and GVE, they are present in pons, and the two nucleus, that is SVA and GSA, they are present in the medulla oblongata. Now here I have shown the diagrammatic representation of the intracranial path of the facial nerve along with the branches. Now let us discuss and we will again go back to that image. First is intracranial course. It arises from the facial nucleus and loops dorsally around the abducens nucleus. Here it arises at the pontomedullary junction and here is somewhere the abducens nucleus. Now it loops around the abducens nucleus. Next, it forms the facial colliculus. Then it exits the cerebellopontine angle. Sensory or parasympathetic nervous system intermedius fiber exists alongside the cranial nerve 8, that is vestibulocochlear nerve. In this image it is not shown, but it exits along with, later I will show. I have attached one image. Here it is. The both nerve, that is facial nerve and vestibulocochlear nerve, is going side by side. Next, the intracranial course. First, internal acoustic meatus. The facial nerve enters in the internal acoustic meatus. Sensory and motor components enter together with cranial nerve 8. In this image, in this arrow shows the internal acoustic meatus. After origin, the facial nerve enters the internal acoustic meatus. Next, it enters the facial canal. Within the temporal bone, they fuse and form the geniculate ganglion and the sensory cell body hub. In this image, here is somewhere the internal acoustic meatus. After entering the internal acoustic meatus, it reaches towards the labyrinth here. And here we can see it is traveling along with the 8th cranial nerve. And inside the temporal bone there is facial canal. The facial canal is below. Now let us discuss the path. After passing through labyrinth, it goes horizontally here somewhere through the medulla, then descends and go through the temporal bone, and here is somewhere facial canal, and ultimately goes outside to give rise the extracranial path through the stylomastoid foramen. In this image also it is evident. Next is, what are the branches in the intracranial path? First one is greater petrosal nerve, nerve to stapedius. It has importance because it dampens the loud sounds. Now the another one is chorda tympani nerve. Now ultimately it exits via the stylomastoid foramen. Now let us see where the branches in diagram. Here is greater petrosal nerve that goes through the pterygoid canal and then ultimately forms a ganglion, that is pterygopalatine ganglion, and supplies the lacrimal gland. The next is nerve to stapedius. It supplies the stapedius muscle. And the third one is chorda tympani nerve. It passes through the lingual canal and ultimately supplies the tongue. It also gives branches to the submandibular gland and sublingual gland. Next, here is the styloid process, and here is stylomastoid foramen. Ultimately the facial nerve goes out through the stylomastoid foramen and supplies the parotid gland, and all the other branches we will discuss later. Now let us discuss the extracranial course and branches. Posterior auricular nerve. motor to styloid and posterior digastric muscle, temporal branch, zygomatic branch, buccal branch, it supplies the cheek muscles, marginal mandibular branch, and the cervical branch which supplies the platysma. Now let us see the branches. Here is posterior auricular nerve. Here it motor branches supplying to the posterior belly of digastric and styloid muscle. Next, temporal branch, zygomatic branch, upper buccal and lower buccal branch, mandibular branch, and cervical branch supplying the platysma. Now for facial nerve palsy, there are tests for motor action of the muscle. Here, as we are not discussing, but let us give a short brief overview. As the temporal branch is supplying the frontalis muscle, we will ask the patient to elevate the eyebrow and test its action is present or not. Then for zygomatic branch, we will ask patient to close his eyes and open. For buccal branch, we will ask the patient to frown, and platysma, we will ask the patient to clench his teeth. Next, the segmental anatomy. What are the segments present in facial nerve? First is intracranial or cisternal segment. Here is the intracranial segment. It arises from the pontomedullary junction and ultimately enters in the internal acoustic meatus. This segment is known as intracranial segment of the facial nerve. Next is meatal or canalicular segment. We have already shown you the intracranial segment, the meatal segment. Here is the meatal segment. It passes through the internal acoustic meatus. Next is labyrinthine segment, tympanic segment, mastoid segment, and extratemporal part. Here it is the labyrinthine segment. This part is known as tympanic segment, which passes through the medulla and ultimately it goes through the temporal bone, that is the mastoid segment, and goes out to give rise to the extratemporal segment. Next are what are the disorders associated with facial nerve. There are two kinds of palsy. One is supranuclear and one is infranuclear. In case of supranuclear lesion, here we can see, here we observe contralateral palsy or paralysis of the lower half of the face, as the upper half of the face is also supplied by the ipsilateral branch of the facial nerve. In case of lower motor neuron lesion, as both the branch supplying that side half of the face, so ipsilateral paralysis of the face is observed. Now let us discuss the lower motor neuron lesion palsy. First is Bell's palsy. It is idiopathic facial palsy. What are the etiology? It is the herpes simplex virus infection. It affects the facial canal part of the facial nerve. Next is Ramsay-Hunt syndrome. It is due to herpes zoster virus. Reactivation of varicella zoster virus gives rise to infection in the region of geniculate ganglion. It also gives rise to lower motor neuron type of lesion. Next is otogenic facial palsy. It occurs due to acute or chronic otitis media, cholesteatoma. Next is facial nerve tumor. What are the examples like schwannomas, glomus tumor, parotid malignancies? As all the tumors are arising in the lower part, so it is also lower motor neuron type of lesion. Next is temporal bone trauma. It also gives rise to problem somewhere in the temporal segment, so it is also a lower motor neuron type of lesion. Now how it occurs? Due to basal skull fracture, often seen with blunt trauma. Next is infections and inflammatory causes like Lyme diseases, tuberculosis of the middle ear, and sarcoidosis, that is Harford syndrome. Hemifacial spasm. Now management. For management, first is diagnosis. To diagnose and confirmation, we do MRI. Now Botox injection can be given for relief of spasm. What does the Botox do? It stops the release of neurotransmitter, that is acetylcholine, in the presynaptic region, and that's how it stops the carry out of the nerve impulse, and in this way it relieves the spasm if it is associated with the palsy. Now microvascular decompression can be done. It is a kind of surgical procedure. In this process, if anywhere in the path of the facial nerve it is compressed, it can be relieved. Now I have discussed with you what are the anatomy of facial nerve and how the disorders are associated with it, and I have tried to simplify as much as possible. If you like this video, please like, share and subscribe my channel, and no need to take the screenshot of these notes. I will send it in my Telegram channel and mention the link in the description box. You can get it from there, and please subscribe my Telegram channel also. Thank you.